and also get our live stream going. 1 second. So it happens when I try to take care of more than one thing at once. And YouTube is being a little slow. All right. Okay, so I just wanted to, and I'm going to be really quick. I've put out a lot of the different data over my Friday messages and things, but one really optimistic thing that is happening is currently COVID-19 cases have been decreasing over the past week, both in the OC and in California as a whole. So on January 15th, there were about 67.8 cases per 100,000 in Orange County. On January 21st, today, there's only 67.1 cases. So that is a slight decrease. Same thing with the testing positivity rates. And you can see in Orange County at 16.7. If you look at South Orange County, just our sort of surrounding zip codes, it's about 15.5%. Our hospitalizations have decreased as well. And our ICU capacity has started to level out, but we're still at 0% capacity. And our death rate in Orange County has also leveled out, although in California, we did have our highest day just this week. So that is overall in California, the death rate is still continuing to rise. Kind of some of the questions that were asked related to what different schools in Orange County are doing as far as in-person instruction. And so most of our surrounding districts, Capo and Irvine, Saddleback, are still doing hybrid instruction. Some of the other districts in South Orange County, Laguna Beach and Newport Beach, are doing hybrid instruction for their elementary schools, but their secondary schools are 100% virtual. But there are actually only 6 districts in Orange County that have hybrid learning going on right now for all of K-12. And then again, 5 districts that are hybrid just for elementary school and not for their secondary schools. And then about 7 districts that are going to be resuming hybrid instruction as of today on February 1st, but some of them do have board meetings coming up. So that's what they're reporting as of today. And then there's 10 districts that are still reporting as being virtual indefinitely, with their reopening dates being still to be determined. Some of those 10 districts were open for hybrid learning before winter break, and those districts can open at any time. Some of them, though, hadn't yet opened for in-person instruction, and so they have to wait until they meet some guidelines that I'm going to go through in just a minute. So that makes it about 61% of Orange County districts that are virtual until at least February. And I know there's been some questions related to, well, the case rate is much higher in North Orange County, and that's why those districts are not in person right now. But one good comparison is Huntington Beach has almost an identical testing positivity rate to South Orange County. We're at 15.6%, they're at 15.5%. And all of their schools are currently in virtual learning until at least February 1st. So it isn't just the South Orange County schools that have, or the South Orange County area that has a somewhat lower testing positivity rate. There are some areas in North Orange County that also have that similar rate, and have also decided to give a bit of a quarantine period or a hybrid or virtual learning period through January. We also just, and I want to thank all of the parents who have already filled out their LCAP survey. We already have about 340 responses. So thank you again for taking the time to fill that out. That really does provide us with a lot of feedback, but not just about COVID, but just about our instructional programs in general that we can use to continually improve. But in relation to COVID, about 58% of parents don't want to resume in-person instruction until at least February. Also, 82% of parents are satisfied with OPA's response to the COVID-19 crisis, and about 88% are satisfied with OPA's communication during the COVID-19 crisis. And then as far as staff, when we polled staff, about 80% of staff don't feel comfortable to resume in-person instruction until at least sometime in February. So then kind of talking just a little bit about testing and vaccinations. We were very excited to hear this week that we have been approved as a testing site for the county. So when we open for hybrid instruction, all of our staff and students will be able to be tested regularly. And that's actually part of the governor's school reopening plan because we are in the purple tier still, that our staff and students will need to be tested regularly. And we were actually one of the first schools schools or district in the state to be approved. When we got approved, there were only 30 other schools and districts that were approved to use the state's new testing lab. So we were really excited to be kind of on the forefront of that and be able to get those tests and be able to get them for free. Otherwise, as part of again, the governor's reopening plan, we would have had to pay for testing, and it can be up to $110, $140 per test. So, so we are really excited that, that we're able to participate in that program and get that testing for free through the state. Also, as far as vaccinations, educators are part of the vaccination tiered system in Tier 1B. Although the initial projections were that 1B would start in mid-February, but with some of the vaccine shortages and some of the other issues with vaccinations, that has led to the date likely being pushed back somewhat for educators to be able to be vaccinated. And students right now, or school-age kids under the age of 16, haven't been approved to get any of the vaccinations yet, but they are starting the clinical trials for some of the vaccines for school-age children. So we're hoping that that will be something that will be available soon as well. As well as being a state test or a county testing site, we're also applying to be a vaccination site so that we can vaccinate our own staff. And then when that vaccine becomes available, we can hopefully also be able to be a place where our students can also be vaccinated if they choose, and be able to do that so that parents and staff don't have to go to the vaccine super sites where they have to make appointments that are very hard to get and sometimes wait in long lines. We'd be able to take care of that on site. So, so we're really trying to get that started. As far as vaccinations go, right now there is no mandate that students need to be vaccinated when the vaccine comes out in order to attend school. However, that could change, and that would be something that would come through in legislation. So that wouldn't be an OPA mandate. That would be something that would come through our state legislators. As many of you may know, the governor put out some new guidelines and mandates for schools. One of them is a new mask mandate requiring that all students wear a face mask at all times when on campus, whether indoors or outdoors. We were encouraging TK through 2 students to wear a mask, but now that mandate does make it mandatory for all students to wear masks at all times. Also, all schools must create a COVID-19 safety plan by February 1st. Ours will be presented to our board at our next board meeting, which is next Thursday. And then we'll post that with any, it's really our COVID safety plan that we already had board approved and we've already updated a couple of times, but we'll post those new updates to that plan. Another requirement is that schools must provide testing for staff and students. And so that will be outlined in that new COVID safety plan. And then as part of the governor's new, and I've gotten a few questions about this because there's some differences in the governor's reopening plan between schools that have already opened and schools that were not open prior to November 10th. We were open for in-person instruction prior to November 10th, so some of these things don't apply to us. We're able to open to reopen hybrid instruction at any time. But for those schools that hadn't opened, they can't open for in-person instruction until their area has less than 25 per 100,000 cases. And it's a phased in reopening. So TK through 2 would open February 16th, and 3 through 5 would open March 16th. However, in the plan, there's no mention of secondary reopening for hybrid instruction. And that's because there has been some research that has shown that because secondary students aren't in stable cohorts, they see multiple teachers and intermix with more students, they're a little bit harder to follow. They don't follow the rules as easily, so they sometimes socialize a bit more, and they are older, and so they are able to contract the disease and possibly pass it on easier than younger elementary age students. So that's why in the plan, as of right now, there is not a plan for allowing schools that are not in or that are still in the purple tier to or districts to reopen secondary schools if they're still in the purple tier. So in a few minutes, I'm just going to open it up to our speakers. But I just wanted to, because a few other questions came in throughout the afternoon, and I just want to kind of add a few things for as far as our reasons for going to virtual learning after winter break. We did feel that it was important because of travel over winter break and because of a lot of gatherings and because of the large increase in cases. Cases almost tripled since before winter break, or the daily case count almost tripled since before winter break, to hold back on in-person instruction for a little while until we saw the case numbers go down to a point where we thought that it would be manageable and safe on our campus. As all school districts have been finding, with all of the quarantining of staff, because of anything from them having symptoms to having exposure, it is a staffing issue as well. There was a New York Times article that was just out that countrywide, there's a huge shortage of teachers and substitutes. I know all of our surrounding districts are also having trouble with staffing, and I think Newport Mesa actually just put out a message to their parents saying that they may have to revert to virtual because of staffing issues. So staffing is an issue. We have hired new substitute teachers. We are using all of our staff to provide that support, sometimes having teachers Zoom in, even if they're quarantined, so that the kids still have that ability to have their same teacher. But that does create an issue because we want to make sure that everyone's safe and still have to follow those quarantine guidelines. I also want to really implore to parents to make sure that you're following all of our guidelines as well. If your students are sick, if you've traveled out of the county, if your students have come in contact with anyone that has COVID-19, If any of your family members have COVID-19, please, please, please make sure that you're keeping your students home for that 10-day quarantine period. I know that I have had teachers express to me that they've had students in their classroom that have said that a parent has COVID-19, and we've followed up and found out that, you know, there were family members that have had it and students still being sent to school, or students who are sick and have symptoms and are still getting sent to school. So so I know, you know, we really want to make sure that we're keeping everyone safe. And so we really need everyone to do their part and make sure that they're not sending their students to school again if they've had any exposure or have any symptoms. Also for families, when you're bringing your student on campus, please follow our pickup and drop off rules. Please don't get out of your car, and also make sure that everyone in your car is wearing a mask. One of the questions that was asked is, you know, with all of these safety protocols and kids are staying 6 feet apart, there's no risk of exposure. But our staff members are having to come in close contact with every single student in their class. And so whereas the students aren't coming into contact with each other, our staff members are having to take the temperature of every single student. Some of them who are working out in the parking lot are taking the temperature of, you know, 100 students a day and coming into contact with those students. And so that's sort of the difference between the contact that the staff is having and the contact that student to students are having. And some of our staff members are getting sick. I know that I do all of the contact tracing, and I come in, and so I have to talk to everyone who contracts the disease. And we've had a few staff members who have actually gone to the hospital, and a staff member who is still recovering, who just got out of the hospital yesterday after quite a long stay in the hospital and having to be on forced oxygen. And you know, the staff member is younger than I am, so it's not somebody who's in their 80s. We've had a lot of staff members who have lost family members or close family friends, and I know that we're all getting faced with, you know, kind of the horrible results of this pandemic. But you know, when they are seeing these things and they still are coming to work, and our staff members, regardless of what our decision is to be virtual or hybrid, if we say that we're going virtual, all of our staff members are incredibly dedicated, and they're still going to come to work, and they're still going to take students' temperatures. And if kindergartners come up to them and ask them for questions and come within 6 feet of them, they're still going to answer that student's question. They are essential workers, but they didn't join this occupation thinking that they were going to become essential workers, that they were going to become, that they were going to be exposed on a daily basis to a deadly virus. They got into this to teach first graders how to read. And so, you know, they became essential workers 9 months ago. And so, yes, they are essential workers and they're going to do their job, but just realize that that isn't the career that they chose, to be an essential worker and be exposed to a virus on a daily basis. So, you know, numbers are going down, and we definitely always look at the data. And I said at the board meeting, and I've said at every board meeting that we use the data to make all of our decisions. We take everyone's input into consideration. And so, you know, we are going to use all of the input from tonight, as well as the fact that the cases are going down, to determine you know, to determine when we are going to open for hybrid learning. We all got into this into this occupation to teach kids and to be with kids on campus. There's plenty of virtual learning schools that our teachers could work at if they wanted to work from home or work virtually. They work at OPA because they want to see students every day. They want to work with students every day. They want to be with your students on campus, but they want to be able to keep themselves, their families, and and all of you and your families safe every day. So, you know, we all want to have kids on campus, but I hope that everyone can tonight keep everyone else's viewpoints, take everyone's viewpoints into consideration, and know that we are taking everyone's viewpoints into consideration in every decision that we make. So I'm going to turn it over. I have all of the speakers listed in alphabetical order. Again, I thought that would be the easiest way to do it. When it's your turn to come up, you will be unmuted, and then you can start speaking. In order to give everyone a chance to speak who wanted to speak tonight, we are going to limit speakers, just like we do in our board meetings, to comments of 3 minutes or less. And again, thank you to everyone who is volunteering to speak and to share your feedback tonight. We are very grateful to be able to hear what you have to say and have all of this input and have all of this feedback in order to make the best decisions possible that we can for our students at OPA and our whole OPA community. So. So I am going to start, and I'm actually going to swap my screen over to my very exciting online timer. And our first speaker is Brittany Bainey, one of our SOC teachers. So if one of my assistants, my admin Vanna White assistants, could please unmute her, then we will have her speak. And then our next person on deck is going to be Beth Beckett. So if you want to get ready as well, Beth, we'll be unmuting you as soon as Brittany is done.
Awesome. First, I want to thank you for being here tonight. This is one part of OPA that I don't think it's enough attention. The time and energy and commitment that parents put forth is unique to OPA and appreciated. I know a lot of parents are here tonight because you want your students to be back on OPA campus. Trust me when I say we truly want that too. As a teacher, I want nothing more than to have students back in the classroom, but we're not at a point where this is possible without so much risk. There might not be a known risk to the students, but the risk to both myself and my family is great. Families at OPA were given the opportunity to return to hybrid or continue with virtual learning in October. Even if they chose hybrid learning, families have always had the option to switch back to virtual at any time they were feeling unsafe. Teachers and staff do not have the same option. Teachers must be in the classroom for hybrid learning to happen. We appreciate all that OPA has done to keep us safe as possible during hybrid learning, but there are still so many variables that are still unknown with this virus. Students are potentially bringing a virus into our classroom each day based on actions taken outside of school. So as safe and clean as we keep the classroom, we are not in control of enforcing those standards once the student leaves for the day. I know this year has been difficult for everyone, and I truly support every family's right to do what they see fit, be it dining in restaurants, taking vacations, and doing what they can to keep businesses open. The trouble I see is when these decisions begin to have a personal effect on my family and the families of other teachers. I have a 2-year-old and 5-month-old at home. They are watched every day by my parents, and I feel incredibly blessed that I have this option. If a student brings this virus to school based on actions taken at home, I now have to worry about myself, my children, and my parents. God forbid something happens to them, I would not be able to forgive myself. The part of this that hurts the most is that it wouldn't have been because of my actions. I'm not going to restaurants, not seeing friends and family outside of my immediate family that cares for my children, and I'm wearing a mask at all times in public. As teachers, we have always put the well-being of our students first. We know that we're going to be exposed to colds and flus every year, and yes, we do get every cough and sniffer that comes into our classroom. We are also usually pretty tough and keep coming to work regardless. We have had to have those tough thoughts of if a terrible event were to take place on campus, how would I protect my students? But this is different. I'm finally standing up for myself and my family and asking, how am I protecting them? I hope the parents are thinking of us when they send the children to campus, but we can't be sure. We seem to be moving towards the end of this pandemic. The hope of receiving the vaccine is on the horizon and very near for us educators. Please know that these actions of staying virtual are not taken lightly. Virtual teaching is not ideal. It's more work for teachers, it's harder for students, and it's tough on parents, and it's lonely for all of us. As teachers, we're not taking the academic and social toll of online learning lightly, but please have faith in the flexibility and resilience of students to overcome any setbacks from virtual learning. They are learning skills now that most of us don't face until college and beyond by having to self-motivate. The stronger need is for the long-term health of teachers, teachers' families, students, and students' families. The learning is still happening, but we all have to be around and healthy to make up for lost time. If you have ideas of how to make it work better, we are here to listen. We know that we can make improvements. I value your right to choose what is best for your family. I also think that it's important to look at the situation from all angles. I hope that my words today have allowed you to see that things from a different perspective, and if nothing else, have shown that we're all just doing our best for our families and our loved ones as well. Thank you.
Thank you, Brittany, and well done keeping it exactly at 3 minutes. All right, our next speaker is Beth Beckett, and then after her will be Jeremiah Chandler. So is Miss Beckett on? And she might be under a different name.
That's what I was going to say. I know some of you are logged on to your kids' account. So if we are calling you and don't unmute you in a timely manner, send us a quick chat so we can exactly see what you're logged in as, and then we can unmute you.
Okay, so we can try Beth when we get through everybody, or see if she gets on in a few minutes. So we'll jump to Jeremiah.
Hello, I'm Jeremiah Chandler. I'm the 8th grade math and science teacher at Saddleback Valley. Like many of my peers, I would prefer to teach in person. It's much easier for both the teachers and the students. It's a lot of work to keep everyone engaged virtually. However, I do not feel safe going back in the classroom right now with cases as high as they are. I have about 30 different students coming through my classroom, sitting in there for about 3 hours. We've had several staff members get sick. Anecdotally, my wife's uncle was just in the hospital on a ventilator. She actually lost another uncle over the winter break there. So we've had some personal losses from COVID. So, you know, if we can avoid it and just wait till the cases go down, I'd feel much safer. The other thing is, like Brittany, I have my parents watching my son, who is under 2, and I would hate for him to get sick, or for if anything should happen to my parents or our in-laws, because they have pre-existing conditions that put them at risk. And so if we can avoid, you know, if we can wait till things get a little bit calmer and we feel a little bit safer in the classroom, that would be, you know, the ideal situation. Ideally waiting till the vaccine gets out, but I know that it also puts a strain on a lot of you with work. When we first started with the pandemic, you know, we were in a situation where we were juggling and we were struggling with childcare, just as I'm sure a lot of parents here are. But, you know, I get that it's an inconvenience and it's difficult, but if we can avoid something a lot worse, you know, if you had to weigh the two, I would rather put, you know, health ahead of inconvenience. Not to put it lightly, I know that it is a huge burden to have to search for childcare, but like I said, we've had these you know, tragedies, and we see people getting sick, and initially we didn't see so many people with the disease, and now the numbers are so high, and we're depending on all 30 people.
Have a good weekend yourself.
Sorry. So we're depending on all 30 people to, you know, it's too much risk, and I think that we should just wait till cases you know, calm down a little bit, or until the vaccine is out, before we go back into the classroom. We want to make sure that you know, first and foremost, the kids and everyone is safe, and we'll do our best to make sure that they are getting the education that they can, you know, with the virtual learning. And that's all I have. Thank you.
Thanks, Jeremiah. We now have Megan Christensen.
Hi, thank you so much for letting me talk to you guys tonight. I just wanted to actually show my support for teachers for staying hybrid, or for staying virtual. I know that My son had missed a sessions last year, and the quality of the education never stopped, never failed. I never felt that he was getting any less of an education because we went virtual. And I have another child at another school where I definitely felt the quality of education went down. So I definitely praise OPA staff and teachers for the quality of education that's continue being given even while virtual. They do so much work. Being hybrid, they're teaching everything twice. Even virtual, they're still teaching everything twice. So I just think they're doing an excellent job. Right now we have Franny and White. Again, super impressed with the quality of education that my son is giving. And I don't feel that he's getting any less of an education being virtual. So I just wanted to thank you guys for that.
Thank you. Oops. Okay, we have Stephanie Cook. Is Stephanie available?
Can you hear me?
Yep, we can hear you now.
Awesome. Thank you so much. Thank you for the opportunity to share my perspective. So it was 2016 when we began our journey with OPA. With a young kindergartner entering school in its inaugural year, I was over the moon to be gifted with the opportunity to provide my children with an educational experience that focused on academic excellence. OPA was founded on the premise that 1, all children are gifted, and 2, the theory of multiple intelligences that state children learn and acquire information differently, and a one-size-fits-all approach doesn't work. It's that idea and mission statement that has allowed for so many children at OPA to not only succeed, but to thrive in school. Now, almost a year into this pandemic, the foundation on which OPA was created is gone. I want to start by recognizing the devastating effects this pandemic has had on the world and the work that you guys have gone into in ensuring a safe environment for our kids by the OPA administration. That is not lost on me. In fact, the school did such a fantastic job that there was not one outbreak at the Saddleback campus during the time students were attending under the hybrid model. Closing the school early during the pandemic was the prudent thing to do because there wasn't enough research for how it spreads. But there are now several studies that highlight low transmission of the disease in school settings, including one from Duke University. These studies support the conclusion that infected adults pose a greater danger to children than kids do to adults. These studies should help inform officials who are struggling to decide when or if to close schools, knowing that these shutdowns are significantly harming children. In addition to vital academic lessons, schools provide many critical services to communities, so much so that the CDC recommended that schools should be 1, the last setting to close, and 2, the first to reopen. I want to give you guys some stats. As of January 14th, 2021, per the CDC, there have been 191 cumulative children deaths aged 0 to 17 in the US and 6 in California. This represents a 0.01% death rate. And of those deaths, 75% of them had an underlying health condition. In 2019, per the CDC, 188 children died from influenza. That's 3 less than COVID. While every child death is devastating, these statistics provided by the CDC highlight that schools should not be closed. You are implementing a solution that is worse than the problem. The devastating impact by these kids over the last 11 months will have severe consequences for years to come. This isn't an inconvenience. These poor children have been an afterthought through the pandemic, and making the decision to close after opening for a few short months was short-sighted, not transparent, and not in the best interest of the kids. Why are we not following Saddleback and Capo school districts? Why is it safe for those schools to open? If you are worried about transmission, families have the choice to stay home. I'm begging you to please bring the children back to school.
Thank you. All right, so our next speaker is going to be Jennifer McElderry.
Yes, some of the information we've covered earlier, but I do want to point out that during the board meeting, we talked about the super region of Southern California, which includes LA, San Diego, Riverside, in other areas. But even within Orange County, case counts do matter. And the fact that you brought up Northern Orange County being higher case counts matters, because only 5% of the cases in Orange County have been in our area. 5% of just Orange County. That includes Lake Forest, RSM, Triple Canyon, Mission Viejo. The pandemic isn't as running as rampant as it is in other areas of the country and in other areas of the county. On the January 6th board meeting, there was no discussion or questions once the plan was presented. It was just, we're going to close down to 100% online learning, and there's no plan for reopening. Maybe it'll be mid-February. Along with that, like with travel and illness during the holiday, that required a 10-day quarantine, if that's what was the concern, which means school would reopen on Monday. This also does not take into consideration the very real impact to families that's like not including the illness. There was a suicide at Ladera Middle School, and there was another death at Dana Hills High School. We are not dealing with Zoom fatigue. The children are feeling disconnected and disengaged. My son felt it was optional to log into science this last week, which we've corrected that impression. Kids are having connection issues. The school site is being used for YMCA and the Boys and Girls Club. So I don't understand why it's safe for daycare, but not safe for school. I am not able to personally work because my kids are not on campus. So it's having a financial impact as well. School is essential, and I appreciate that teachers did not, sign up to be essential workers, but even essential workers, like, they're not having higher like infection rates than the rest of the population. My husband's a firefighter, and he comes in contact with people who have been infected, but has not contracted the disease himself. They use precautions, the mask and gloves and everything else. The PPE does prevent the disease. The infections don't usually happen when they're in a setting with PPE. They're usually happening at home or with family gatherings, which isn't going to stop whether it's January or February or December. I'm sorry, I'm out of time.
Thank you. Okay, our next speaker is going to be Kelly Fogarty. Kelly, are you on the line?
Yes, can you hear me?
Yep, perfect.
Okay. Dr. Kernan and our OPA admin, thank you so much for your hard work, your dedication, and providing an opportunity for all of us to share. My name is Kelly Fogarty. I've been an OPA parent since 2011 and have been a staff member since 2017. I've served on Honor Society as a room parent and currently on our school site council at SOC. OPA is my community, it's my family, and this family has weathered some pretty big storms over the years, and the COVID-19 pandemic has given us yet another opportunity to overcome some pretty massive difficulties, obstacles, and tragedies. From where I stand, I often see my daughter in tears because she misses her teachers, her friends, and all the good things she receives from OPA every single day. From where I stand, I also see teachers, staff members, and parents in tears because of the devastating losses they've experienced due to COVID-19. I see teachers struggling with the pain and frustration from not being able to teach our kids in person. I see teachers trying and doing a great job at pivoting to work harder than ever to provide a high level of education through a screen. I've seen coworkers come to work and talk about saying goodbye to loved ones fighting for their life, and they had to say goodbye through an iPad. Nothing about this has been easy. None of us asked for this, and it has stretched everyone, parents, teachers, administrators, and worst of all, our kids. I've spent many days holding my breath, waiting for a text with an update on coworkers, part of my OPA family who are in the hospital on oxygen, trying to just breathe. It's very sobering. Our OPA family has been hit hard by this pandemic, and it should not be taken lightly. I ask that those of you in good health be grateful and not take it for granted. I ask that those of you who are fighting to get us back on campus, please be patient and support the decisions our administration is making to keep all of us safe. We are a small but mighty community, and we have to remember that this isn't going to last forever. It hasn't been easy, and everyone has suffered on some level as a result of this pandemic. I am a parent who wants nothing more than to see my daughter happy and thriving on campus as soon as possible. But my heart could not take one loss of life within our community. Please remember to be kind and trust the people who have to carry the heavy burden of making decisions that greatly impact the lives of over 1,000 children and adults here at OPA. Don't lose hope and know that it's going to get better.
Thank you, Kelly.
Thank you.
Okay, our next speaker is Amy Hitzler.
Hi, hello everybody. I'm going to stay off camera if that's okay. It's been a long day.
No problem.
First of all, I just want to say thank you for this opportunity. I think that this is such a productive way to share feelings and thoughts and ideas. And I know that I'm gaining a lot of perspective just by this opportunity tonight. So I just want to say thank you. And I know that all the parents on this call recognize the priority of the OPA staff is keeping our kids safe, keeping our teachers and staff safe. And we are very grateful for all that you've done in this awful situation. I think I was a little blindsided when we came off of, coming off of break. I really expected 2 weeks because I feel like that was very reasonable. I know we can't really ask parents or staff not to travel or gather over winter break. I mean, it's tough. It was Christmas. The holidays are really tough, but I just expected like a 2 week would be very reasonable. I'm one who would like to see my kids back on campus. I have two who aren't at OPA and they're back on campus, and I just see a difference in how they are learning, their attitude. It just breathes new life into them. And I just have trusted the safety protocols that you all put into place. They've been working. We had an awful uptick in November and December, and our student COVID dashboard is 0. I mean, and 0.5% on campus of staff and students. So I trust the systems you put in place. I'm disappointed to hear parents are sending their kids to school sick, because that's not cool. That is not right. But hopefully most of us are following the guidelines and doing it safely. And I just would like to see us back on campus as soon as possible. I mean, the vaccine's coming more and more each day. Numbers are dropping in the Orange County region, especially the South Orange County region. I honestly feel like we should be 2 counties at this point. And I'm looking forward to more reopening plans, not closing down more. I just feel like we're going in the wrong direction. So I just want to say thank you for the opportunity to share my thoughts there. Once again, thank you for all that you're doing. I do have a couple questions just regarding the presentation so far. Number one is, 58% of parents want to see us wait till February. Was that in any way filtered between parents who've chosen in person or virtual? And also, like you mentioned, testing of students. Is that something that parents would get approval of, or is that just a new mandate that the governor has put out that I'm not aware of? So maybe if you could clarify those 2 questions, that would be fantastic. But thank you once again. And thank you, everyone. Teachers, it's so nice to see your faces.
Thanks, Amy. All right, so our next speaker is going to be Yasaman Jahanager. Sorry if I killed your name right there. Yasaman on there? And if you are, you can unmute yourself if you're on under a different name. Okay, we'll see if we can get back to them in a minute. Let's have Philip Lyle.
Hi, thank you. I will start my video, even though I don't think it provides any value whatsoever, or at least I think I started my video. I don't know if it actually showed up. Thank you very much. I don't have all the same quality of prepared remarks as has already been seen, but thank you for the opportunity. I work for a school as well. I work for Chapman University. I am an essential worker. I have spent most of the last year supporting faculty and employees in the same transition that OPA is doing. So thank you for all your hard work. I know what you're going through. And certainly the faculty, the teachers that have spoke previously, your concerns are the same as I think teachers in every school in Orange County. I don't think that's unique. I did want to say, though, that these concerns about risk are still going to be there next month, right? You know, nothing is going to change this month to next month. So if we're worried about, you know, exposure, you're essentially saying that we'd have to stay, you know, closed until the vaccine is prevalent, which is the summer. Obviously, Orange County schools are not doing that. I do appreciate the slides in which we you described these school districts that were temporarily closed and reopening, but I do question some of those numbers, to be quite honest. And in particular, the Huntington Beach district that was mentioned is a high school district. Elementary school, I believe, predominantly is open. A lot of them didn't close, as you indicated. Some of them did temporarily, but you know, if you read the OC register, those schools that did temporarily close all had reopening dates set. They already do, and they're almost all going to be back in the next week. So we're not. So we are different from most of Orange County in my mind. There are some differences, you know, maybe very specific areas may have higher infection rates, but we are making a decision that is very different from the rest of Orange County. And then I want to reiterate also about listening to the science, right? You know, nationwide, a lot of schools are open. You don't see widespread reports of infections, transmission from students to teachers. We didn't have that issue in the fall. We didn't have it in November, December. And my kids have gone to the YMCA since March. They have been going the entire time because both myself and my wife work full time. And luckily, because we do have our jobs, we can afford to do that. But those great staff at the YMCA have been taking risks, evidently. But our protection has worked. They wear masks, they socially distance when they can. And there's just no evidence, there's no scientific evidence that there is a significant risk for teachers in the classroom. And I understand your concern. I have the same concerns too, but a lot of essential workers in a lot of different industries, and especially for our youngest students, this is really the last year without us being in the classroom. Thank you.
Thank you. All right, next we have Crystal Mandel. Crystal, are you in?
There you go. Yes, I am.
All right, I'm going to start.
Okay. Hi, everyone. To those, thanks for the opportunity to speak. My name is Crystal Mandel. I'm a fairly new addition to the OPA family. I started last school year. That's my first school year. I'm an education specialist at SV. And more recently, my son became part of the OPA family as a student. So I'm speaking as a parent and staff member. I'd like to express my support for the decision to return 100% virtual while our county is seeing this surge in COVID-19. It's not like anything we've seen before. It's much higher. I don't think it's a coincidence that we all went back to school and things started opening back up, and there's a huge surge in cases. So I do feel very strongly that safety is our top priority. And I've worked in a lot of different schools. I'm new to OPA, but not to teaching. I've worked in a lot of different schools, but I really see a very unique thing at OPA where the teachers and parents all work together to help the students and to make learning continue to happen. I was so blown away by the support and planning that went into the initial move to virtual learning that I moved my son to OPA. I know parents that know who might have a child like I live in Huntington Beach schools, and the elementary schools are closed at this point. They might have a reopening date set for, I think, February, but right now they're closed. They did go back to being virtual as well. You know, when OPA closed, my son basically got no instruction, you know, or not when COVID first hit in March. He got like no at the district school, and so I decided to move him to OPA, and I've seen that he is learning based on the dedication of our team. I know that they're continuing to grow. I work with the special needs students, and I see them growing. Students who have been at home the entire time, who've been in virtual the entire 100% of the time, they're not falling behind. They're not getting any less of an education than the students who were going on campus and hybrid. You know, I know this is a very incredibly stressful time. I do have faith we will continue to work together, you know, to support our students and our children. And I do want us to wait until it's safe to return to school. I have faith that once this vaccine rolls out, we're going to be in a better place for school to reopen. And, you know, that we will come out stronger at the end of this or at this time. Thank you.
Thanks, Crystal. Okay, it looks like Yasaman is back, so I'm gonna give her chance to speak. She might have gotten dropped off accidentally. So Yasaman Jahanager. Are you there?
Hello.
Hi, you can
Hi.
go ahead.
Hi. Hi. I'm selling for my mom. Selling. She's in the OPA since 2 years ago, and then I'm so happy over there. I saw every time the teacher, they support her, and then the family as well. And then during the pandemic, everything looks great. And then they support the kids, the family. And then she was on a hybrid, and then I was happy about hybrid, you know, but now she's on virtual, and but I prefer she's going like hybrid, which is your classes, they are safe, they're like so clean, and then she's going after school as a YMCA, and then she's like, to me, that's so good over there. They are so watching the kids, and then that's really watching for whenever they are on the classes, the virtual. I'm so happy she's there.
Thank you. Whoop. Okay, our next speaker is Brandy Matthews. There she is. All right, go ahead.
Am I good? Okay. Yes, thank you so much for having the town hall. I really appreciate it. It's a great chance for us parents to get on and be able to speak to everyone and teachers and staff and everybody else. I am on the side of bringing our kids back to school. I feel like a 2 to 3 week break was reasonable and you know, helped us get over the hump of the holidays, but do feel that my kids do better back on campus. I did have some questions. I thought maybe we'd be able to talk. I know this is just a 3-minute thing, but I wanted to see if you guys would be able to talk about how we're determining the COVID cases on our website. Because right now it says our website, I think our staff has 2 members and our kids are 0. So that would be something I'd love for you guys to talk about, how you're determining those COVID cases. The other thing that I would be interested in to know is if any teachers have gotten sick from a child at school. I don't know if that's something you can talk about. Obviously, I know you can't talk about who it is, but if that's happened, that would be, I'd love to hear about that. The other thing is, I know we're getting information from the OCDE Health Department or the Orange County Department of Health. I would assume Capo's doing the same. And so just that they're back in school and we're not. So that's something that if they're going to OCDE and listening to them as well, why are they in school and we're not, I guess is the question. Another point, I'm kind of jumping all over the place, but another point is that I'm really sad that we're losing really, really good families to the district schools because they're at school. Friends of mine their kids are going to school 5 days a week and are at school 5 days a week. And so being on campus 5 days a week, they're having recess, they're having lunch, and those are neighboring schools to OPA, SOC. And so that's just something else that I know parents are looking into, and it just makes me so sad to lose some of these families that have done so much for our school. And so that is just something near and dear to my heart, that I don't want to lose anybody else. I don't want anybody else to leave because I love this school. I've done, I have 3 kids at this school and have, put my heart and soul into it too. So I'm trying to think if there's any other questions I had. I think that's probably all that I have for now, but thank you guys so much for doing this, and we really appreciate all you're doing behind the scenes.
Thanks, Brandy. And just to kind of clarify, I'm going to go through and we have some questions in the chat as well as questions from our speakers. So at the very end, just so that I have everybody's questions all together, I'll go through and answer those questions that you guys have had in the chat as well as from the speakers. So Brandy, I'll be sure to get to your questions. All right, so our next speaker is Russell Miller. Is Russell on? Russell, if you're under another name, you can also unmute yourself if you'd still like to speak. Okay, we'll come back to Russell. Our next speaker then is Travis Morsoli.
Hi.
Okay, go ahead.
Yeah, so thank you for having this meeting. My wife and I were pretty disappointed when we heard the news on the 5th of this month. I think for starters, like a couple of people said, OPA's done a great job of, bringing the kids back to school, even though it was later than the surrounding districts, which was a little disappointing to start the school year with. The one thing I was a little bit irritated about was the presentation during that board meeting. And then it was decided that there was going to be a vote and then discussion afterward. That seems kind of interesting to me, and how, as a unilateral presentation that took into account data that didn't even include Orange County basically in it. And then there was a vote before any discussion, which I don't know, it just seems very weird to me that that's the way things work. But maybe I'm new to how boards work and that's just the way things go. I wanted to thank Stephanie Cook and Philip Lyle for their great speeches. I think they did an amazing job of presenting some data. Myself, I teach at Chapman. I'm a physical therapist and an instructor for the last 12 years at Chapman. And I was the first one to go back to campus in late August in the whole county of Orange. I teach 20 kids, 10 hours a week, graduate students, much riskier, living by themselves, living outside of the house, commingling, whatever they do, roommates. We're easily within 6 feet with them for 5 hours at a time. It is what it is. Did I sign up for the possibility of getting sick when I took that job at Chapman 12 years ago? Absolutely not. But it's something I have to do to educate the future of physical therapists within our county and our state. I respect teachers' decisions for the possibility of getting sick, but there's a lot of workers who didn't sign up for the possibility of getting sick, from Amazon drivers to supermarket employees to you name it. So, it is what it is, and there's a job you signed up to do to teach the kids, and evidence has shown that kids don't learn well online. Evidence has shown that kids don't get sick while they're at school. Evidence has shown that adults don't even get sick at schools because kids aren't great carriers of this disease. So, the adults who are getting sick at OPA likely are getting sick from some other way, from a supermarket, from dining out, from living their life, from what they're doing, and it's not kids transmitting to them. OPA's done a great job keeping the kids safe, and I think we should have gone back after break with the same parameters that would have closed the school before break. Concerned with percentages of kids getting sick in classes, quarantining, and stuff like that, and I hope we go back soon.
All right, thank you. Our next speaker is Kimberly Parkan.
Okay, can you hear me?
Yes.
Okay, so I should first start by thanking you all as well. I am here also as a concerned mom. I also am a healthcare worker and a physical therapist as well. I too have been working this entire pandemic. I have not skipped one day of work. My husband as well is a healthcare worker. We both leave the home every single day. We work with the public with proper PPE, and neither of us have been sick. I'm sure we've been exposed, but to our greatest knowledge, we are all healthy and perfectly fine. We've tested and we are perfectly healthy at this point in time. But I will first start by saying I have something prepared, but 2 days ago I read the news and my mom heart broke when I read that a child in Orange County that's 14 committed suicide. And the article claimed that his parents said his kind of last ditch was when he heard he couldn't go back to school. He felt like he had nothing left. And that hit home because my son, who just turned 13 over Christmas break, has been depressed, he told me, since he couldn't come back to school, to OPA, since he's stuck at home. Now, he has straight A's. He is bored at home because he needs to come to school. He loved it coming back to hybrid, but he's bummed out. Hybrid does not, or virtual school does not work for either of my children. So health is more than just not being sick with COVID. And I think we're missing the boat with the whole health thing here. So I'm gonna read you the rest of what I've written really quick because I only have a minute left. We brought our kids to OPA for something different, a different learning experience where all of their needs would be met in the classroom, and online learning is falling very, very short of that for our specific family in that area. I would like to know why OPA is not trying to fall in line with the other area schools with the guidelines to keep the children in the classroom. Our immediately surrounding schools, Capo, Saddleback, and Irvine offer hybrid. And I understand that many area private schools are safely offering full day classes in person with safe COVID measures. How can we get back on campus? I feel like our children need more support, deserve more than the teachers are giving them and can give them through the screen. It's just, they're trying their hardest. The teachers are doing wonderful, but my daughter, my son, they don't learn through a screen. It's just not enough for them. And the teachers are they're doing great, but a screen is not class. And I don't understand why we can't do more. So thank you. We need more. We need school.
Thank you.
Thank you.
And we have TJ Quigley.
All right, thank you very much for as being a Q. I wish I registered under my wife's maiden name, Bear, but that didn't happen. Hope you guys laughed at that. I'm trying to lighten it up a little bit here. This is a very contentious subject. That's 8 seconds I lost. All right. First off, I need my kids on school immediately.
You start talking.
I completely disagree with the 2 to 3 week break. Online learning is falling short, and this is with 2 kids in the program that are getting straight A's. It's great. The teachers are doing the best they can. They're awesome. I saw Miss Batchelor on here. I'm not sure if the rest of the teachers are on here. They are doing the best they can, but I think in person was a huge difference between now going back to 100% virtual. I joined OPA because I thought it was a school not controlled by unions. I'm very disappointed in switching my student from Lake Forest Elementary, both of my kids, in October. So they already went to school for a month and then had to switch over to now going virtual when everybody else went back. There's no consistency in the reason why we're doing things here. The importance of in-person learning cannot be underestimated. And I realize COVID is a risk. I'm in healthcare. I go to the hospital. It is a risk. I understand it. It's part of the job. But like everybody else said on here, we do what we need to do from a job perspective to get paid. My dad is a certified professional crossing guard. Okay, he goes every day. He's 73 years old. He hasn't gotten it yet, escorting kids across the street at other schools around the district. He hasn't had any problems and hasn't gotten COVID yet. I'm tired of the anecdotal evidence that people are quoting on here. We need to stick with the facts. Let's talk about some facts. I'm pulling up the COVID rates right now of the surrounding schools. Let's start Lake Forest Elementary. They've been back since the beginning of the year. Current staff positive cases, 1. Current positive cases on students, 3. Linda Vista, 1. Every single one is 1. These are not big ends. It is not being transmitted to the teachers. I get the concern. I'm concerned. I want to take all the precautions possible. And I really believe the precautions that you've taken have really made that. I'm very curious to hear where this N came from as far as how many people responded to the survey. I'm sure you're going to do that, Dr. Kernan, because as you know, statistics can be played and I don't know who responded to it, but I'd be very surprised to hear that 60% of the parents, judging by this call, are excited to have their kids not go to school because this is awful. This is a problem. I switched to this school for a reason. And setting a precedent of waiting for a vaccine is a huge mistake. You might as well just kiss 2021 school year goodbye. This is not going to happen. We're not all going to be vaccinated. There's not going to be critical mass. We're not going to have any sort of reliancy on the vaccines until at least late summer. I heard Phil say beginning of summer, but that's not the case. I want this to be based off of facts. That's all I ask, not anecdotal that I know a cousin that did this. Let's look at real transmission rates in schools. Thank you.
Thank you. Okay, our next speaker is going to be Charlie Sessions.
Awesome, thank you. My name's Charlie Sessions, and I'm a 5th grade teacher at SOC. I'm also going to speak as quickly as possible because I'm speaking on behalf of a staff member who's currently recovering. So as COVID continues to be present in our lives, we as a community seem to be losing patience. But even though our patience is wavering, the virus is not. Now more than ever, we need to recommit to keeping everyone as safe as possible. During the time of working hybrid, I've been exposed to COVID 2 times, one test resulting in an inconclusive, requiring immediate quarantine. This impacted last-minute quarantine for my family. My students had a wonderful set, but still wasn't their teacher. And I was actually denied prenatal appointments even after my set day of quarantine. Being pregnant during the pandemic has been a load of constant fear, but it has not stopped me one bit from serving my students at the best of my ability. Due to COVID, hospitals are overrun and our frontline workers are working tirelessly, being called to different areas. My son has hearing issues, which has negatively impacted his speech development. Specialists are being pulled to support COVID cases, leaving my son's ear and throat surgery on hold until things get better. OPA teachers have proven from the beginning we're not trying to take an easy way out. We flipped our practice in a weekend without training to be virtual teachers. We're self-creating everything and spending money on anything and everything we can think to help or work for our students, spending hours troubleshooting. For those who commented that your students have the right to an education, we all agree, but that education just has to look a little different right now. Teachers have stepped up. We're sacrificing our physical health, our mental health for our students. We have to be smarter and safer, and that's to stay home and figure out ways to make this work. Being in person does not fix all of our problems. The virus is real, it's deadly, it does not discriminate. A coworker has recently been hospitalized for 6 days and is still recovering. Her experience has shown that COVID is not just a 14-day quarantine and a ticket back to life. She was lucky to recover and be released home, but her walk with COVID is not over. It has an undefined ending. She is dependent on help with bathing needs. She needs medication and machines, all accompanied with a financial burden. From the moment of being left in a wheelchair curbside, filled with fear at the emergency room, she never stopped worrying about her students, immediately striving to get communication out to her families in any way possible. She knows that especially in these times, we are the students' consistency and we try to be that virtual or hybrid. She wants to be with her students, but physically cannot. The COVID ripple effect is destructive and has proven to be endless. The fear and obstacle spreads has spread to all aspects of her life. My coworker's life has involved 27 family members testing positives and other deaths. Teachers are devastated to not be in the class with the students, but rushing back to normal life, people are making the choice to endanger people who care for them, essential workers, teachers included. People are going about their day either naive to the fact that the virus is real, cannot fathom the impact it may have on them or their loved ones, but we can get through this if we do this together. COVID isn't a matter of if you'll get it, but it's a matter of when you'll get it in our current situation. Thank you.
Thanks, Charlie. All right, our next speaker is going to be Courtney White.
Yep, I'm here.
All right, Courtney, go ahead.
Good evening. For those of you who don't know me, I am Miss White, and I have been a teacher at OPA for 5 years. I was raised as a student in district schools. I always saw myself being a teacher in district schools. But the day I found OPA, I knew I was at home. I love being in the classroom, and anybody that knows me knows that I love energy, and I love the energy that OPA students, family, and staff bring to the classroom. I thrive on my in-person interactions with students, and I find joy daily in seeing their smiles and watching them grow. That being said, over the last few months, being in the classroom has brought a higher level of stress than joy. I was
Sorry,
so
I can't
concerned
hear. I
about
can't find my.
Sorry,
I was so concerned about keeping my students safe that I didn't get to feel that same level of happiness. I was watching their distance, making sure their masks were on correctly, and constantly worried about what they were doing outside of my eyesight. The concept of possibly putting my students, coworkers, and family at risk was constantly on my mind. Nevertheless, I pushed through, even when that meant I personally was locked in my bedroom for 2 weeks, teaching from home but I was still there for my students. But things have only gotten worse since then. Our state is struggling, and I am hearing of family and friends who are doing what, for all intents and purposes, is safe and following the rules, and they're still getting really sick. And it scares me to think that my coworkers, my OPA family, or any of us could be in that situation. I spent much of my break with that exact concern in my head, worried about what might happen when we returned. When the board ruled to return from break virtually, I finally felt a sense of relief and that I could actually breathe and enjoy my break. Please understand, I want nothing more than to be back in the classroom with my students and in person. But I plead that we continue to take the family we have at OPA into consideration. A handful of cases, despite seeming like a tiny number on a dashboard, has a huge impact on the community, and it's felt deep into our hearts. For that reason, I think it is important that we continue to focus on safety and is doing what is best for our staff and our families. I assure you that as teachers, we are continuing to do everything in our power to bring our students the most engaging and hands-on experience. I know my fellow teachers and I want our students to be happy and learn as much as anyone else. But if I'm being truly honest, I'm scared. I'm scared for my students. I'm scared for my own family. I'm scared for all of us. As a teacher, I always pledge to protect my students from everything I possibly can in any way I possibly can. And I don't feel I have that power in person right now. Thank you.
Thank you, Courtney. Okay, and next we have Scott Winiger.
Can you hear me? You good? So thank you for allowing us this avenue to speak. We're going to talk about stats. Let's talk about stats. How about 400,000, over 400,000 deaths due to this disease. Try and talk about, mortality rate or the chance of surviving to those families. The ICU beds, that's alarming. The availability of ICU beds, COVID, it's not just COVID. You get in a bad car accident, you have a bad fall, you have a bad allergic reaction, and you need to get intensive care. Well, good luck with no ICU beds. I'm sorry, it's just, at the start of winter break, my grandmother, positive. This isn't, oh, I know someone. This is my grandmother who's responsible for looking after my daughter. So I can come to work and teach your students. It goes without saying, I hate virtual learn. I hate it. It is a struggle. I deal with the anxiety of looking at a screen all day. I would much rather see my kids face to face, joke with my kids, laugh with my kids, get hands on and just, do science experience with my kids. My grandmother, she's not out of the woods yet. She's still dealing with it here in Orange County. My wife works at a school in Orange County. She receives daily emails about student positive cases that are exploding. The dashboards are not accurate. The way those numbers are posted are not accurate. We watch the numbers that she gets reported and we check the dashboards, they are not accurate. We're not asking that we shut down school forever. We're asking to wait for the numbers to come down to a point where it is safe. I understand we take risks every day in our lives. I'm not saying that I want every student vaccinated. I am asking for the opportunity to allow myself to get vaccinated, okay? Yeah, students don't pose a risk. They have a bad cough for a couple of days and they move on. Let teachers have the opportunity to get vaccinated. This is a community that we should be looking out for each other. Every day, I would hear students talk about family gatherings before winter break about how they're going over hanging out, students coming to school while parents, family members in their house are having pending tests. That is not being a community member that's thinking about the well-being of teachers. We want to keep our students safe, and we would appreciate that the community would want to keep us safe as well. We're providing this virus an environment to thrive. Let teachers get vaccinated before we think about coming back. I also, in regard to the survey, I filled that survey out, and I believe the survey was sent out after it was announced that OPA was going virtual. So the validity of the numbers, let teachers protect themselves. We want to be back in the classroom. Let us protect ourselves. Let us get vaccinated, have a chance before we go back into the classroom. Thank you.
All right, thanks, Scott. I'm gonna go back and just see, is Beth Beckett here? Did she come on? Beth, if you're on, you can unmute yourself. Okay, how about Russell Miller? Are you on? Okay, we have just a few other speakers who wanted to speak. So since a few of our speakers didn't show up, I'm going to call Tina Asadi. Are you on, Tina?
Yes, I am. Thank you so much. Okay. First, I would like to thank you for having OPA's best interest at heart and for all that you do for the school. That being said, I wholeheartedly disagree with your decision to close the school. To begin, OPA has communicated that it's a leader among schools and set an example of success. However, when the Capistrano School District allows schools to reopen for on-campus instruction on September 29th, OPA decided to be a follower. We were advised that the school wanted to remain closed to see how it plays out. Why all of a sudden did OPA decide to be a follower instead of a leader? OPA could have led this area by adhering to the necessary protocols for safely returning to school, but instead decided to stay closed until October 21st. Thus, OPA students were behind other students in returning to on-campus instruction by more than 3 weeks. This has significant impact on mental, behavioral, educational, physical, and social well-being of students. Currently, all non-chartered elementary schools in Capital Valley and Saddleback Valley school districts are reopened for hybrid instruction. It is now evident that the board believes it has superior knowledge on the health and well-being of our children in taking action that is completely contradictory to the action taken by most school districts district in Orange County, as more than 50% of elementary schools in Orange County are open for hybrid. Following winter break, Capistrano School District and Saddleback reopened schools for hybrid on-campus instructions on January 4th. At OPA, children were given an extra week off school to total 3 weeks. However, this was not enough to satisfy the board, and therefore children were now forced to stay home. This is despite the fact that we've never had an outbreak of COVID in the school. This decision will have detrimental short-term and long-term effects on children. It is well known that children need social interaction, and this is more prevalent for elementary age children. They need to see other children, be in structured school setting. Many benefits of schooling as priceless. It is at school where students develop friendships, learn to be patient and trust others, become more goal-oriented, and acquire valuable social and communication skills. Virtual learning is very likely better than no education at all, but at its present stage of development, it remains a poor substitute for classroom instruction in elementary and secondary schools. The adverse effect of online learning at the elementary and secondary level are best documented by studies of virtual charter schools. Numerous studies show lower performance by students at virtual charters than by those at attending nearby public schools. Sorry, I have a lot more, which I'm not going to get to. So maybe I can just get an email of everyone or be directed to an email where I can send the rest of my essay. So that's it. Thank you so much for listening.
Thank you. And if you'd like, you can send an email to any of our administration staff, including myself, amy.kernan@oxfordchampions.com.
Okay, perfect. And then I can ask you to forward to the people I want to send it to, or?
I can't forward it to all of our parents, but.
No, to the board members.
Oh, yes, definitely.
Okay, perfect. Thank you.
All right, thank you. Okay, and next we're going to have Bindu Mishra.
Okay, can you hear me?
Yeah, go
okay,
ahead.
Awesome. So this is impromptu, actually. I wasn't planning to speak, but I just thought I have my all daughters teacher here. So I just want to say thank you. Thank you from my bottom of my heart. I know this is our first year in OPA and middle school for my daughter. It has been really tough year. It's not easy. And she's a single child. And in OPA, she didn't make any friends, zero friends. Socializing is zero. We don't have family. So I'm not going to take too much of time, but I just want to say thank you. And also what I feel like, means having no socializing, no friends, and being a single child. My husband and I work full time, and we work 10 hours to 12 hours in a day, once in a while. So it's not easy on her. However, I still feel like we are fortunate to have her healthy and being home. And I always think like, hey, pick your poison. Do we want to be out there and get like even 1% chance, I would say. Like we have some friends, we have my coworker, my husband coworker, they died because of the COVID. And when you work with them so closely and you see that they are so active, they are so healthy, and one of the kid, even their family died because of the COVID, a 3-year-old. So it's really make me really sick, honestly. Like I don't, then I think, okay, this is the perfect what I have right now. So I just want to say thank you to all the teachers.
Thank you. Next we have Dana. I don't have a last name, sorry. Are you on? D-A-N-H-A?
Yes, I am. Sorry. It's yes. Both my sons attend OPA, and I would like to express my gratitude to the teachers and staff that help that and make that happen. Listening to a lot of the other parents speak, I share a lot of their frustration. The being a essential worker, I've been exposed multiple times with PPE, have not contracted COVID thus far. It is something that is somewhat unknown and that can make it scarier than it is. And with the unknown, the desire to be safe can take on a whole new level. And I would like to hear maybe from the board or from staff, the term safe has been used a lot about how return when safe. And generally that's been defined thus far from my understanding as the testing rate for the county of Orange County. And I just think that misses the point of what safe is. Like, life comes with risks, and it sounds like a lot of parents are accepting of those risks. And thus far, it sounds like most of the staff is not. As far as the survey goes, I did not receive the survey. I texted another parent quickly, and they said they did not receive the survey. So I was curious how that survey went out. And then when another parent discussed about that survey being parsed out, especially with the teachers all stating that they do not want to come back to school thus far until it's safe. I'm curious how that parsed out as well in terms of the staff responses compared to the rest of the parents. As far as it goes, I am aware of Orange Unified School District. They have 8,500 staff and students in their elementary schools, and thus far they have anywhere from 0.05% infection rate for their schools at any one time. It seems like that we're missing out on educating our children. That is the ultimate goal of the school. And I share a lot of that frustration with watching my kids go through this and not getting quality education. And Orange Unified is all day full instruction. I know some of your staff used to work there, but since September, all day instruction. Thank you.
Thank you. Okay, and we have Karen Kaufman.
Hi, thank you for giving me the opportunity to speak. I'm actually speaking, my name is Karen Kaufman. I'm the ed specialist at SOC, and I'm actually speaking for Natalie Bates, our school psychologist who is on Zoom and can't speak. So I'm going to read her remarks, and then if I have time, I'll add mine. Okay, I've recently returned from maternity leave, and the anticipation of returning to hybrid has kept me awake. Besides having a newborn, my daughter was born with a medical condition and will require major surgery in a few months. I live in North Orange County area where cases are rampant. And although my family and I are being safe in the community, I constantly worry about becoming infected while at school and bringing the virus home to her and my immediate family. Additionally, my family has suffered 2 personal losses to COVID, my aunt and my grandmother. I primarily work with the most needy population at our campus, and I am confident that our staff can continue to provide the best quality educational program in a virtual model until it's safer to return to campus for all of us, students, parents, and staff. I just want to add, it's scary being on campus. I mean, that's, I think, the honest truth, and I think most of my colleagues would say that. I have been responsible for being in the parking lot every single morning, taking temperatures, opening car doors, helping little kids out of the car, helping with backpacks, touching kids, car seats and helping kids unbuckle. And it's scary. I mean, just the honest truth. We wear PPE, we wear our masks, we wear gloves, but we're coming in contact with everyone. My car ride to school, I kind of have to psych myself up knowing that I'm going to be asking those questions and kind of sticking my head near the window. Is anyone sick? Does anyone have a cough? And it's frightening. I mean, I'm not 20 years old. I'm a little bit older, but I'm healthy, and I've been quarantined twice because I've been exposed at school to other staff members, and that's frightening. And so I've had to go on to virtual, to be able to teach virtually while we were on hybrid. I do have to say that the students that Natalie and I work with are our neediest students on campus, and they're really thriving. Many of them are doing exceptionally well during virtual learning. one of my middle school students has read 7 books in the last 2 months, mostly with me. So the motivation and the one-on-one time that they're getting is invaluable, and the time that they have to work individually to work on their goals and to work on their schoolwork has really been a positive experience, and I do hear that from parents. So, when we talk about safety, the gentleman just spoke, what does safe mean? To me, I would love to be vaccinated and be on campus without having the fear of getting sick. And I think a lot of staff members would feel that way. When you hear about one student or one teacher positive, that's a whole family. Our other colleague who's been in the hospital, there's a whole family of people that are now sick. And we know the ripple effect of this virus really extends beyond the one individual person. So I know we would all love to be back on campus. This is my, I think, 9th year at OPA. I would love to be there, but it's a scary place for teachers right now. Thank you.
Thank you, Karen. Now, Betsy Freiler.
Hi, I just wanted to thank you for giving me this opportunity to speak. And I wanted to remind parents that OPA is a commuter school. We attract students from all over because of how excellent we are. It's not just Mission Viejo. So just the adjoining areas isn't all that matters. And OPA is different because of our teachers. However, if we are endangering our teachers, they will leave, or worse. It affects adults more, which is true. However, it has shown that we do have that variant that affects younger people in the area. While virtual learning is not the right solution for everyone, it's not forever. We're just asking for patience. My son is part of Scholar Academy, and it has made him so much more independent and so much more confident. It has brought back a missing piece in the curriculum, which is technology for younger students. And this is the closest thing OPA has done to prepare students for jobs in the future. This is a step in the right direction. While it's not forever, we're just trying to do the right thing and be safe for our students and teachers. Thank you.
Thank you, Betsy. All right, I'm going to allow a few more speakers and then kind of close it up. So the next person who asked to speak is the Walkers.
Hello, everyone. I just want to say, I don't think anyone misses being at OPA more than I do. I loved being on campus. I miss the traffic control. I miss staying in shape, walking around the campus, doing whatever I could to help out. And when I think about life itself, what is the most important thing? I think the most important thing is to keep our children, our families, our staff, and everybody as safe as we possibly can. This is a temporary thing. It's not fun. It's a difficult thing, but if we continue to work together and do our best to be safe, I think we're going to make it if we keep trying. And I just want to say to all the parents that want to get your kids back in school, like immediately, like right now, let's remember, we want to keep our kids, don't we? Don't you want them to grow up and be able to share with your grandchildren and their kids about this pandemic that we survived because we paid attention and we were as careful as we could possibly
Oh
be?
my God.
Thank you.
Anyway, I just wanted to say we've had COVID. It is a difficult thing. And the most important thing for us is for the safety. I see some of our teachers in there that we've had at the past, like Mrs. Smith, Bachelor Seeley, Mrs. White, Becker, Mrs. Kaufman, Mr. T, Mrs. Simone, everybody. And we have a son in Scholar Academy. We have 2 that just love online learning, and we have 2 that are struggling. I mean, 1, our son. But at the end of the day, like Mrs. Kaufman said, there are some perks where we have learned that, okay, he's excelling in certain areas, but at the end of the day, it's a matter about safety. We have people that work that are educators that are in South County. We've had 2 doctors pass, And unfortunately, we have 25, 26 doctors, and a lot of them are afraid. They're shutting down their offices. This isn't our doctors in Ladera Ranch. And we have a doctor that's in Chalk. We have some that are in Newport Beach. And unfortunately, they have been affected. We took our son to an endocrinology appointment. The doctor was affected. They had to call us back and say, hey, we just got a test. One of our nurses had it. We're so sorry this has happened. So there's really the sad thing about it is this is unseen. And so I think at this point, it's worth it. It's worth our kids' life. It's worth our teachers' life that we see you guys all again, and that we just be as safe as possible. To us, it's worth it. Every one of our kids are worth it. So we want to say thank you, OPA. Thank you to the staff, and thank you for supporting and doing whatever you guys can do. We appreciate it.
All right, thank you, Walkers. Okay, we have Alexandra Dreyer.
Hi, I'm here. Can you hear me?
Yep.
Hi. Hi, everyone. To say I'm disappointed is an understatement. I thought that the protocols that were in place were really, really effective. And I was really proud of the way OPA was handling the safety on campus. And now, I mean, one of my closest friends has an 11-year-old son, student at OPA also, who's suicidal, depressed, not learning, doesn't work for him. My own daughter in 7th grade, always been a straight A student, not anymore. Can't focus. It's a struggle every day to get her to remain engaged. And, you know, I hear the teachers saying they're scared. And, you know, I mean, scared, if you're using PPE properly, I don't understand why you would be scared, number one. Number two, I hear a lot about childcare concerns, but, you know, as working parents, we all have childcare concerns every day, always. You know, that's just the reality of it. And many of us parents are essential workers also. You know, and I know you said teachers didn't expect to be considered essential workers, but, you know, things change and you have to roll with the changes. This is not a good situation. It is impeding the social development of our children. It's impeding our children's education. And I think it's completely unnecessary. And I've said it before, I resent the fact that you refer to parents as stakeholders, but we really don't have a stake. These decisions are, you know, made about, like last year we had with staffing, with firings of staff and this, it's made without parental input. So are we really stakeholders? I mean, it doesn't feel like that. And that's all I have to say. Thank you.
Thank you. And then it looks like Russell Miller is on. So Russell. He was on. Are you on again, Russell? Okay, we'll move to Christina Gutierrez.
Hello, everybody. I thank you for the opportunity to speak. I wasn't planning on doing so, but after hearing, you know, both the teachers stand and where parents are standing, I kind of feel the urge to do so. I understand. I also want to add to that list of thankful parents from the bottom of our hearts. I do feel the effort that's been put into our kids' education and the virtual strains that it's, you know, putting on everyone. I also want to acknowledge the fact that it is scary, and it is scary for everyone. But we as families are trying also our best to make decisions and to take into considerations everyone's safety, not just our families. And We also are as workers, but the fact that we are talking about safety as if it's just some random thing that happens if we are just not thoughtful enough. It's concerning. I myself, I'm not working because of this whole thing, and I decided that was a personal choice. I understand that it has nothing to do with the fact that the kids are in school or not, but it had a big impact on my decision. I decided to stay home. Financially, this had a big impact in our household, and my husband still essential as I was, but I decided to stay back home and support my kids as was needed, because there's no way around it. The priorities are my kids. That's the final word on that. To that end, I want to mention that we've been talking about academics, and just mentioning how we're striving to get the best education for our kids. I understand that OPA is a choice school, and we're going to be celebrating that in a couple days, and I am proud of being part of the OPA family. But I also want to point out that there's also a choice for parents that would like to stay home and do 100% virtual, and the ones that wanted to go virtual, and that choice got taken away from us unilaterally. I don't want to mention it felt very shady to have the kids come home with all their school materials and workbooks since, December whatever 19th or whatever. They came home with all their books, and I was skeptic. And then when I found out on January the 5th that we were actually not going back, it kind of I don't want to sound pessimistic, but it kind of gave me the, oh, there it was. I was fearing this was coming, but it wasn't 100% transparent. And we weren't given a voice. This was voted unilaterally. And I just wanted to mention that the kids' best interest also comes with the emotional part of it, as a lot of parents have already commented on. The strain that this has been put into our kids is significant. I can't stress enough how difficult it is for some parents, because of the personality of the kids, to get them in front of that computer and engage. It's not the same. I understand that there's different kids that learn differently, and that's why we are at OPA, but it's just not, it's hard.
I'm going to need to let we have a few more speakers, so I'm going to need to.
I lost track of the time. Thank you so much for letting me speak. Thank you.
Thank you. Okay, we have three more. I think it's Marjan Monfred.
Hello, I'm Marjan Manfared. I'm a pediatrician. I have ABC Children's Clinic at Foothill Ranch. There is a lot of dilemma with this virus. When it first started, there was a misconception of how dangerous this virus is, how they stand and suddenly drop, which came from China. I was thinking of encephalitis first, meningitis. Then because of miscommunication, everybody was thinking of ventilator. Then later on, we figured out this virus was a very rich surface that caused blood clot that caused from different receptors. The problem was a stroke, was a multisystemic effect on the body. So I was exposed initially to this virus, and I can assure you 100% that in children, I had a very, very low number of the COVID positive. There is no ACE receptor 2 in the nasopharyngeal part of their system. It developed till 11 years old, and they're not contagious. A lot of pediatricians, they think kids should go to school, and it damaging the comorbidity of kids not going to school is tremendous. I see a lot of anxious kids, a lot of depression. Kids lost the ability to socialize. They're becoming look like autistic kids. They develop not to speak. They are losing their speech. They're losing mobility. Kids are growing in size that we have a huge problem with obesity. These are a problem that affect them for life. The social skill they have to develop. They need to have a development in this stage. It damages them for life. If you let them not to go to school, it's really, really huge problem for the kids in future. And I see a lot of children in the office. How come those people that have money to send their kids to private school, their kids are so happy, and those who have to go under the district, educational district, they have to close down the school on them. This is not fair. The system is not fair. And I feel responsible to speak up on behalf of all the patients, all these children that are suffering, their education, social skill, mental skill, they are deteriorating. The suicidal rate is increasing. Thank you.
Thank you.
I appreciate the time.
Thank you. Okay, we have just 2 more speakers, and then I'll try to quickly get through some of the answers to the questions. Tiffany Stevens.
Hi, I'm here. I'm outside, so can you guys hear me?
Yes.
Okay. You won't be able to see me, I don't think, because it's kind of dark. Let's see. I don't know if you can see me or not. Okay. Hi. I've been at OPA since the day it started. All of my children have gone there, and I have one left, and we were hoping that he would get to stay, but we're really considering leaving because of the shutdown. I teach at Glen Yarmouth Elementary School, which is literally right down the street. And I've been teaching since September. I go every day. I do, at the beginning, I felt unsafe because the kids didn't know protocols, but I teach 4 and 5-year-olds, and you can teach the 4 and 5-year-olds, you can teach the junior hires, you can teach everybody. There's really no reason not to be at school. You just teach them the right procedures. We wash our hands before school. We give everybody gel in the middle of the day. Our kids actually eat snacks, and we go outside and play as well because we teach them how to clean things, how to be safe, and how to stay away. If you can touch your friend, you're too close. We have shields. We have all the safety that a regular school that you guys had in place as well. So saying that you feel unsafe, that's part of you as a teacher. You need to figure out a way to make yourself feel safe and the kids feel safe by following the protocol and teaching the kids. Yes, it does take a little bit of time. Like I said, I teach 4 and 5-year-olds. So everybody can be taught. So my other concern is my child is part of the special ed program. It's one of the reasons why we love OPA so much. They have helped him immensely. According to the IEP, he's passed some of the speeches, and that's all due to OPA. And I don't want to leave OPA, but he is falling far, far behind. My husband is a firefighter. We've both been taking days off school because off of work without pay. I've been taking sick leave to watch him because I have nobody else to watch him. So I'm actually getting docked pay by doing that. My husband can't work his normal days as a firefighter because we're trying to go between having him at school and not at school, and then we're at school and then we're not at school. My middle schoolers had to watch him a couple times, which is very unfair for him. And he's just falling behind. We work all day. I work until 4 o'clock, and I have to go home and then I have to reteach him. It has nothing to do with his teacher. His teacher's trying. He's doing awesome. It's not that. It's the virtual behind the screen trying to focus when you're a kid that can't focus anyways. So when you're in class, he can focus, he can pay attention, he can do the things that he needs to do. When he has to be on a screen, he thinks of it as like TV, and I can get up and I can walk around and I can do whatever I want. I don't need to watch this person on the TV. So I would really appreciate if we could go back as soon as possible. Thank you.
Okay, thank you. So it looks like we don't have any more speakers. So I'm gonna kind of quickly go through and just try to make sure that I hit some of the questions that were asked, as well as the questions in the chat. As in response to the survey, there were about 350 responses so far. Like I said, to the parent survey, there was a separate survey given out to staff members. So the staff responses were actually not part of the 58% or any of the percentages from the parent survey. That was just part of the parent survey. Also, for the, there were some questions about testing students. We do, as part of the governor's reopening plan, need to provide testing for students. However, parents will have the choice as to whether their students are tested or not. I've been on several webinars, as well as working with the California Department of Health regarding the testing. And the test that the kids are and the staff will be taking isn't like the tests that maybe some of you have had, where it basically they're kind of swabbing the back of your throat. In this test, it's just swabbing the front of their nasal cavities. So it's much less invasive, and actually students as young as kindergarten and even transitional kindergarten can be taught how to do it themselves. So it's much less invasive than some of the tests that were done early on. But again, that would be based on parents giving their consent for testing. As far as the reopening funding that is being proposed by the governor, that is still a proposal. It hasn't been approved yet. But some of the things that we would look for using that funding for is, of course, making sure that we have enough PPE for all of our staff, and extra masks and things for students, sanitizing needs, things like that. And then also looking at ways that we can, again, improve instruction for our students and try to gain back some of that instruction that we know across the country has been lost due to the coronavirus. So we have 2 intervention teachers, 1 at each of our sites. So looking at expanding intervention for our students, maybe expanding time that our students have that instruction available. If that means having summer enrichment available to them, we're looking at a bunch of different possibilities to be able to use that funding. As far as determining COVID cases on our website, us, like most other school districts, are following the Orange County Healthcare Agency guidance on this. So it really is those staff and students who were infectious or possibly infectious while they were on campus. So if we're talking about students who are in virtual learning right now and not not on campus at all, even if we have those cases reported to us, we would not we wouldn't post those on our COVID dashboard. And that, again, is in line with the guidance that has been provided to us, so that different school districts' dashboards are the data has similar is reported in a similar way. And then there was some questions about if any teachers have gotten sick from students. We do, the state doesn't do any of our contact tracing, really. We have to, all school districts and schools, including us, we do our own contact tracing. I've been through several trainings. I'm the one who does the contact tracing for us. Because this virus can be transmitted in so many different ways, we do have a few staff members that we were not able to trace where they got it. So I don't, I can't say definitively whether or not, or not any staff members have actually contracted it on campus from from staff to student or student to staff. There was a situation with our YMCA after school program at one of our campuses where a student did contract it from a staff member at the YMCA. And so that is one case between staff and students that we do, that we were able to verify. Let me see. As far as the survey was sent out in my Friday message from last week. If you're not receiving the messages from myself or from your chancellors on Sunday, and again, the survey link will be sent out this Sunday for anybody who missed it in the Friday message last week. So, but again, if you're not receiving those messages, please reach out to the school office so that we can check to make sure that your settings in ARIES are allowing you to receive those messages. Sometimes parents go in and check that they only want emergency messages. If you go in and do that, then that will keep you from getting those regular Friday and Sunday messages. So just, you can go into your ARIES portal, just make sure that it's checked for general notifications, as well as emergency notifications. And if that is set and it is still not, you're still not receiving them, then again, reach out to your school office. Also, again, I want to implore to our parents to make sure that you are following the guidelines. We do have a lot of, or not a lot, but we do have some students who are traveling out of state to compete in athletic competitions or club athletics or tournaments. If you are traveling out of state or even out of 100-mile radius, which is the guidance from California Department of Health, you do need to quarantine your student when you return. So if you're going to those weekend tournaments or going out of state for other sports, please make sure that you are quarantining. There's another question about the closure for quarantine for the winter travel. It was recommended by Dr. Chow, who is the director of the Orange County Healthcare Agency, that schools do have a period of quarantine after the winter break. And that was on a call with all of our Orange County schools and districts. It was a recommendation. So a lot of this is recommendations, they're not mandates. And so school districts are allowed to make their own decisions. So Capistrano doesn't have to follow those recommendations if they don't choose to. But we, just to make sure that we are following all of the guidance when those recommendations are made, we like what I showed in the slide, like most other Orange County school districts did follow that recommendation. And that's why most of the school districts are not opening until at least February 1st. So, you know, that came and that's why we followed that guidance. And then again, I think I already covered this. Testing is we have to offer that testing as part of our reopening plan, but again, it is a parent choice. And then let me make sure that there aren't any. I tried to pull all of it off of the chat. The vaccine at this point is not mandatory through the state. So we are, it is still a choice that people have whether to get vaccinated or not. As far as right now, us being approved for a testing site, that is a testing site for our staff and our students. So it wouldn't be a testing site for family members or the public. Same if we're approved as a vaccination site, we are requesting to be approved right now as a vaccination site for our staff and students. We only have one school nurse. So to open up for public vaccination would be difficult and put a huge strain on our staffing, and we want to make sure that our school nurse is there for our students. So so that really would be for not for public vaccination or public testing, but more just for our OPA staff and students. And let me just make sure. I think I've covered everything. If I didn't cover one of your questions, please feel free to email me, and I'll be happy to get back to you and answer any questions that you have. Also, oh, special needs students and hybrid. We are going to make sure that we have a plan. Our Scholar Academy team is really working hard to make sure that we are meeting the needs of all of our Scholar Academy students. If the virtual learning period is extended, then we will be reaching out to families to make sure that that they are having their needs met, and that we are covering them, even if that means having to or means having them come on campus to receive some support. And then there's a few more questions coming in. So we will be having a board meeting next week, and so next Thursday, and we'll be going over our plans, taking in all of this input as well as the input. The survey is open until next Friday, but taking in the input from the surveys as well as the most recent data to make sure that we have a date, at least a tentative date that we can give you as far as when we are going to be opening for hybrid instruction. So I hope that you'll all join us for our board meeting, and then, you know, be able to get that information about when we will be reopening for hybrid or in-person instruction. I apologize if I missed anyone's questions. I'm trying to scroll through. Like I said, I was trying to write them down as they were coming in. But again, if I missed anything, I'll also post some answers to any questions I might have missed on the website. And so, you know, I'll possibly put a link in there in my Friday message tomorrow. So I want to just thank everyone again for participating in our town hall. And again, thank you all for your input, and thank you all for your support of OPA. We truly appreciate all of you. And this will be this is being recorded, and the recording again will be available on our website as well. So if you want to go back and see any answers to any questions or anything like that, we'll have that posted by tomorrow on our website. So I want to wish everybody a good night, and thank you again for joining us tonight. And we'll see some of you hopefully at our board meeting on next Thursday. Thank you.
Thank you.
Thank you.
Thank you.
My parents, you got blasted by